Good morning. I guess the challenge is if you follow a senator and then follow a physician who is earning 20 billion a year, you were saying? Only 19 cutbacks. Where do you go from there? I'm unfortunately an art student by training, so I don't know if this qualifies me to look at healthcare. But I guess it should be a friendly crowd. My understanding is on the Hill, the blackberries have been quite popular for the last couple of years, at least. I think you were definitely one of our first and most loyal clients. So Research Motion's actually a Canadian company. We've pretty much started this movement in the smartphone world, and now we have some great competitors from Microsoft and Apple and Google all coming in. But I think where I wanted to kind of set out and dive into the discussion is really, what does it mean at the point of care? What does it mean to start using some of these tools that is in everybody's hands at the point of care? So today on the planet, I'm told there are about 5 billion cell phones. So there's 6.5 billion people and 5 billion cell phones. This means that over the next every next couple of years, all those cell phones are becoming smarter. They're becoming smartphones. So what does it mean if we have pretty much everybody in the population that has access to the internet on a small device that's with them all the time? What does it mean if tablets like the new playbook that we brought out, and the iPad and others, are $500 toys that are actually really powerful computers that can be in the hands of every clinical worker in their healthcare system? What does it mean at that point of care when we can really have access to the technology we need? And I think this is really the opportunity we see. We've been looking at the Smart Kit for quite a few years now. For about 5 years or so, we've focused on the healthcare space, and it's definitely been a growing concern. But we really see two sides to the coin. We see a great opportunity within the delivery of care to equip nurses with technology so they don't walk as much. The average nurse is walking 5 miles a day. 12-hour shift, 5 miles a day. That's a lot of shoes. That's why Crocs are so popular, because at least they're comfortable as they're walking on the steps. What does it mean if we could bring, basically, the current paradigm is there's some phones sitting somewhere in the nursing station, there's some pagers there, doctor is needed to discharge the patient, and the nurse has to basically page that doctor, and page them again. Did you page your doctor? No. There's a lot of delay in that process, a lot of wasted time. Our caregivers, I think the numbers are staggering. I think your average nurse in the US is 49 years of age. He or she is spending 19% of their day with their patients. So 20% of their day with patients. They're spending 36% of their day entering information into computers, because we need to prove the care that we delivered, because we want to make sure we don't get sued as a result of it. They're spending a large portion of the day, and it goes anywhere from 20–30%, looking for stuff, looking for people, looking to get information. And that's why they're wasting so much time walking around. We talk about in this country, in Canada, in the UK, where I'm from, and many Western countries, the challenge we don't have enough clinical workers. And I challenge that and say we don't have enough information in their hands, tools that we all use in our private lives in their hands, so they can focus on what we need to do, which is spend more time with the patient. So one of the things that we've been working with University of Pittsburgh Medical Center up in Pittsburgh is really to equip the nursing staff with smartphone technology. Now they can page the doctor from the device in their hand. They can click a single button and they can speak to whoever they need in the care team. When they want decision support, as we talk about, to make sure that they're doing the right procedure, they have that available with them wherever they are. It's not an expensive solution. It's a couple $100 per nurse to put it in. But what is the things that are inhibiting that change? On the patient side, I mean, I also look at it and think, we talk a lot about prevention. And now if so many of the population have access to the internet, have access to the mobile internet, the mobile social internet, which is the next piece that's coming after you, what can we do to take advantage of that to help people be informed about their care? I tell a very silly story, and hopefully people will not laugh too much at me. I used to go walk with my dog. I get a little Shih Tzu. She's all of, I don't know, 10 pounds or something, a little bundle of fluff. And I used to think, I'm doing pretty good. I'm going to walk every day. And I got a new app on my phone from Adidas. It tracks, using satellite tracking, it tracks how far you walk. So I went dog, and I thought, I wonder how far I go. Half a mile. Totally useless. I was telling myself that I was doing a good thing walking the dog every day. So I'm like, oh, you're going to tell me half a mile is not going to help me whatsoever. So I started going a proper walk. It was about 80 degrees. It was a pretty hot day. Took the dog, we just passed the mile mark. I had to carry her the rest of the walk because she could not handle it. And I was like, oh. What that taught me is technology can inform me as a patient, so I'm not lying to myself. I'm not fooling myself that I'm doing something. And I think that's when I start looking at the whole spread of applications in the mobile space. There's a lot of solutions now to eat a little bit more healthier, to exercise a little bit more, to manage your condition of diabetes, to help you be informed to take care of yourself, because we have to. My best buddy's a physician, and his advice to me is don't get sick. I mean, that really is sad when that, I mean this is the state of play. But I think through the technology now, if we can line it up, we can have the solutions where we're keeping track of chronic diseases. We can use our resources more effectively, and we can have a remote diagnosis. We can have a nursing team that can give input back to the patient. We can have that closed loop of feedback. And I think if there's anything, I just kind of wanted to start off quickly and set it up and get my colleagues here to speak further. Where I'm looking at it, I don't think technology is in the way. I think the technology is there. I think the challenge we have, and I was at a think tank up in Canada where we work with Canada Health Infoway, which is our federal investment. We don't probably have $20 billion, I think it's about $2.5 billion, but it's a smaller country. Looking at the same issues, how do we drive this change? And I think one of the things that really struck me that was quite on the money was the technology's not in the way. The tools are there, all scripts and the applications can bring it all together. What are we going to do differently to implement that, to take the best practice from places like Kaiser or from UPMC or some of these centers and drive it into people who are all doing it? And secondly, what are we going to stop doing? I mean, I think that's the challenge. We can't just have more. We can't just have more doctors. We can't have now a phone and a pager and a BlackBerry and a Fraser and an iPad and a computer and a card. What are we going to do to bring it down to the things we need to do? What are we going to do to stop paying for some of the ways we treat care now and push to better ways of doing it? So what are we stopping to drive this forward? So maybe I'll set that out as a starting point and continue discussion. Thank you for the opportunity.